Addiction. It's a word that carries weight, conjuring images of struggle and despair. It's a silent battle that many fight daily, often hidden from the eyes of those around them. We often associate it with substances like drugs and alcohol, but its reach extends far beyond. Addiction can manifest in many forms, including gambling, food, and even technology. We must break down the stigma surrounding addiction and create an environment where seeking help is seen as a sign of strength, not failure. Encouraging open conversations and providing resources can help in this endeavor. Let's shed light on this critical issue, fostering a culture of compassion and support. Together, we can create a supportive network that prioritizes the well-being of every person, ensuring they have the strength to continue their vital work.
Substance abuse can take many forms. Let's explore some common signs and substances. Alcohol abuse can lead to physical and mental health problems. Signs of alcohol intoxication include slurred speech, impaired coordination, aggression. Stimulants can lead to increased energy, euphoria, and decreased appetite. Examples are cocaine and methamphetamines. Signs of stimulant intoxication include increased energy, restlessness, agitation, paranoia. Withdrawal from stimulants can be severe and may include depression, fatigue, and cravings. Misuse of prescription drugs can be dangerous. Common prescription drugs misused include opioids, benzodiazepines, stimulants. Addiction doesn't always involve substances like drugs or alcohol. It can take many forms, each with its own unique challenges and impacts on individuals and society. It can manifest in various ways, some less obvious than others. These forms of addiction can be just as debilitating and difficult to overcome as substance abuse. While we often focus on chemical dependency, it's crucial to recognize the broader spectrum of addictive disorders that can impact anyone, including healthcare professionals. These disorders can be behavioral, psychological, or even digital in nature. Gambling, for instance, can be highly addictive. The excitement and anticipation of winning can create a powerful urge to keep playing, even when the odds are against you. The thrill of the win, the allure of one more try, these feelings can hijack the brain's reward system, leading to a compulsion that's hard to break. This can result in significant financial losses and emotional turmoil. What starts as harmless fun can spiral into a life-consuming obsession, leading to financial ruin, broken relationships, and severe emotional distress. The impact on mental health can be profound, often requiring professional intervention. Then there's sex addiction, often misunderstood and stigmatized. This form of addiction involves engaging in sexual behaviors compulsively, despite knowing the negative consequences. It's not about having a high sex drive. It's about engaging in compulsive sexual behaviors despite negative consequences. This can lead to feelings of shame, guilt, and isolation, making it difficult to seek help. These behaviors can consume an individual's thoughts and actions, impacting their work, relationships, and overall well-being. The constant preoccupation with sexual activities can disrupt daily life and responsibilities. Technology addiction is another growing concern, especially in our digitally driven world. The constant need to check our devices can become overwhelming. Excessive use of smartphones, the internet, and social media can lead to a compulsion that mirrors substance addiction, affecting sleep, work, and personal interactions. This can result in a lack of real-world connections and increased stress levels, highlighting the need for balance and mindful usage of technology. The chemically impaired nurse, a looming threat. Chemically impaired nurses pose a significant risk to patient safety. Their impaired judgment and motor skills can lead to medication errors, improper procedures, and compromised care. The consequences can be devastating, ranging from minor injuries to life-threatening complications. Consider a nurse struggling with alcohol addiction. Arriving at work hungover, their coordination shaky, they attempt to insert an IV line. Their unsteady hands miss the mark, causing the patient unnecessary pain and increasing the risk of infection. This seemingly small error, a direct result of their impairment, highlights the potential for harm when addiction goes unaddressed. The threat extends beyond individual patients. A chemically impaired nurse can compromise the entire healthcare team, eroding trust and jeopardizing patient care on a larger scale. Their actions can lead to delays in treatment, miscommunication, and a decline in the overall quality of care. Addressing this issue requires a multi-pronged approach, combining early detection, intervention, and support systems to help nurses reclaim their lives and protect the patients they serve. Section 5, Spotting the Signs, Recognizing Addiction in Colleagues. Recognizing the signs of addiction in our colleagues is crucial for early intervention and support. Addiction can manifest in various ways, and being vigilant can make a significant difference in the well-being of our team members and the safety of our patients. These signs can be subtle and easily dismissed as stress or burnout, but early detection is vital for preventing potential harm to both the nurse and their patients. It's important to differentiate between normal work-related stress and the more concerning signs of addiction. Behavioral changes often serve as red flags. A nurse who is usually calm, and collected may start exhibiting unusual behavior, acting out of character, or showing signs of distress. A colleague who was once punctual and attentive may start arriving late, calling out sick frequently, or appearing withdrawn and isolated. These changes in attendance and social behavior can be early indicators that something is amiss. Their performance may decline, marked by careless mistakes, difficulty concentrating, and a decline in their usual attention to detail. This can be particularly dangerous in a healthcare setting where precision and focus are paramount. Physical indicators can also provide clues. These symptoms can sometimes be more apparent and harder to hide. Bloodshot eyes, slurred speech, and tremors can be telltale signs of substance abuse. These physical symptoms can be indicative of various substances and should not be ignored. Changes in appearance, such as weight loss or neglecting personal hygiene, can also raise concerns. A drastic change in physical appearance can be a sign that a colleague is struggling with addiction. 2. Mood swings and personality shifts are also common. These emotional changes can affect their interactions with colleagues and patients. A colleague struggling with addiction may exhibit increased irritability, anxiety, or defensiveness. These emotional responses can be a reaction to the stress of hiding their addiction or the effects of the substances themselves. They might become more secretive, especially regarding their whereabouts or medication use. This secrecy can be a way to conceal their addiction from others. It's important to remember that these signs alone don't confirm addiction. They warrant concern and further observation. It's crucial to approach the situation with sensitivity and care. If you notice these changes in a colleague, it's crucial to document your observations and report them to a supervisor or a designated resource within your healthcare facility. Early intervention can provide the necessary support and resources to help a colleague in need, ensuring the safety and well-being of everyone involved.
For more educational videos and opportunities to earn continuing education credits or CEU, visit www.advancedpractice.io. Follow us on Instagram @advancedpractice.